This question says, a medical assistant accidentally discloses a patient's confidential health information to an unauthorized individual. This incident is an example of a violation of... Option A says HIPAA. And HIPAA regulations refer to the Health Insurance Portability and Accountability Act. And this means that all of your information regarding your health or any information that a patient gives is confidential and should not be shared with anybody. So this sounds like a great contender because the question is discussing their health information and it's saying that it was given to an unauthorized individual and that this was a violation. So this is sounding a lot like a HIPAA violation. So we will go with choice A, but let's look at options B, C, and D to be sure. Option B is discussing OSHA guidelines, and OSHA has to do with occupational health and safety. So a violation of an OSHA guideline might be one that puts an employee in an occupational state at risk due to a health hazard in the work environment. So this doesn't have to do with the health information, and that's not what was violated in this situation, so we could eliminate choice B. Option C is the Stark Law provision. The Stark Law provisions refers to a conflict of interest for a provider. So let's say that a provider has financial stakes in a specific imaging company or an X-ray building, and they refer patients here for financial gain for themselves. That would be a violation of the Stark Law provisions, which is different from the scenario up here, so we can eliminate choice C. And then the Good Samaritan laws, that law relates to how it sounds, Good Samaritan. So that means that if there's a person, let's say a civilian on the street, and they find someone down on the ground, they need to perform CPR on this person, and let's say the person that they perform CPR on survives but has cracked ribs, and they go to sue the good civilian, Good Samaritan on the street who saved their life. The Good Samaritan law protects that civilian from any charge against them because they act in good faith. So that is very different from this scenario up here, and therefore we could eliminate choice D. So after looking at all of the choices, it definitely seems that this is a HIPAA violation. Health information was given to an unauthorized individual, and that would be choice A.